Hello all, hope you're doing well today. Today we are talking about chapter 20 and we're looking more, this is part 2, looking more at myocardial infarction, stroke, and peripheral artery disease. Here we go. Myocardial infarction or heart attack, stroke, and peripheral artery disease are all cardiovascular conditions that involve the narrowing or blockage of blood vessels, leading to restricted blood flow and potential damage to vital organs. Here's a brief overview of each condition. A myocardial infarction occurs when there's a blockage in the coronary arteries which supply oxygen-rich blood to the heart muscle. The blockage typically results from the buildup of plaque or atherosclerosis in the arteries. If the blood flow to a part of the heart is severely restricted or completely cut off, it can cause permanent damage to the heart muscle. A stroke occurs when there is a disruption of blood supply to the brain. It can be caused by a blockage or an ischemic stroke or bleeding, which is a hemorrhagic stroke, in the blood vessels of the brain. Ischemic strokes, similar to heart attacks, often result from the buildup of plaque in the artery supplying the brain. Peripheral artery disease is a condition characterized by the narrowing of blockage of the arteries that supply blood to the legs and the extremities. It is primarily caused by atherosclerosis and can result in leg pain, limited mobility, and an increased risk of infections or non-healing wounds in the affected area. While these conditions have distinct characteristics, they share common risk factors, including high blood pressure, high cholesterol, smoking, diabetes, obesity, sedentary lifestyle, and a family history of cardiovascular disease. Exercise plays a crucial role in the recovery and long-term management of myocardial infarction. While it's important to consult with a healthcare professional for personalized guidance, here are some general guidelines regarding exercise after a myocardial infarction. Before starting or modifying an exercise program, it's essential to undergo a comprehensive evaluation with a healthcare professional. They will assess your cardiac function, overall health, and any specific considerations related to your client's myocardial infarction. Based on their evaluation, they can provide specific recommendations and clearance for exercise. Participation in a cardiac rehab program is highly recommended after a myocardial infarction. These programs are designed to help individuals recover safely and improve their cardiovascular health. They typically include supervised exercise sessions, education on heart-healthy lifestyle habits, and emotional support. Cardiac rehab programs provide a structured and monitored environment for exercising, ensuring safety and proper progression. Exercise should be approached gradually and progressively for someone who has had a myocardial infarction. Start with low intensity activities and slowly increase the duration, intensity, and frequency over time. This allows your client's body to adapt and reduce the risk of overexertion or complications. The principle of start low and go slow applies to both aerobic exercises and strength training. Aerobic exercises such as walking, cycling, or using cardio machines are beneficial for cardiovascular health. So, start with low impact activities and gradually increase the intensity for at least 150 minutes of moderate intensity aerobic exercise per week, or as recommended by your healthcare professional. You can do some strength training exercises under proper guidance. You can also improve overall muscular strength and support cardiovascular health. Start with light weights and focus on a variety of exercises targeting major muscle groups. And you always want to make sure that you're using proper techniques and ensuring safety for your client. It's important that you make sure that they are paying close attention to their body during exercise. And if they experience any chest pain or discomfort, severe shortness of breath, dizziness, or other concerning symptoms, stop exercise and have them seek medical attention. It's important that they make sure they're listening to their body and not pushing through any signs of distress. Recognizing the signs and symptoms of a myocardial infarction or heart attack is crucial for seeking immediate medical attention. Symptoms can vary from person to person, and some individuals may experience a combination of symptoms while others may have atypical symptoms or no symptoms at all. Here are some of the common signs and symptoms of an MI. This is the most common, chest pain or discomfort is the most common symptom of a heart attack. The pain is often described as a tightness, pressure, squeezing, or heaviness in the chest. It may be persistent or come and go. The pain can radiate to the arms, usually the left arm, jaw, neck, back, or stomach. Feeling breathless or having difficulty breathing can occur during a heart attack. It may be accompanied by chest discomfort or occur independently. Some individuals experience feelings of nausea, indigestion, or vomiting during a heart attack. These symptoms are more common in women. And profuse sweating, often described as a cold sweat, can occur during a heart attack. The skin may feel cool and clammy. A feeling of lightheaded, dizzy, or fainting can be a symptom of a heart attack as well. It's particularly important to take note of these symptoms, especially when accompanied by other signs of a heart attack. Unusual or extreme fatigue without apparent cause or relief with rest can be a warning sign of a heart attack, especially in women. It's important to note that the severity and duration of symptoms can vary. Some individuals may experience mild or intermittent symptoms, while others may have severe, persistent symptoms. Additionally, women and older adults may have different or more subtle symptoms compared to men. If you or someone around you experiences any of these signs or symptoms, it's crucial to call emergency services immediately, to go to the nearest emergency department. Early medical intervention can help minimize the damage to the heart muscle and improve your client's chances of recovery. It's better to seek attention and have the symptoms evaluated, even if they turn out to be unrelated to a heart attack. Exercise should begin with a warm-up period of 5 to 10 minutes of light aerobic activity to gradually increase your client's heart rate and prepare their body for exercise. Similarly, each session should end with a cool-down period to gradually lower their heart rate and allow their body to recover. Stretching exercise can be incorporated during the cool-down phase to improve their flexibility. You always want to make sure that they are taking their prescribed medications as directed by their healthcare professional. Some medications, such as beta blockers, can affect their heart rate and exercise response. It's going to block their heart rate. So they're not going to be able to get up to the typical 50 to 60% of their maximum VO2 max or whatever. You want to make sure that they, of course, consult with their healthcare professional to understand any specific considerations regarding exercise and medication management. So instead of using heart rate, you would actually use your RPE scale, so rating of perceived exertion, and making sure that it's in a moderate range, low to moderate range. Exercise should be complemented with other lifestyle modifications, including a heart-healthy diet, smoking cessation, stress management, and maintaining a healthy weight. These lifestyle changes work synergistically to improve overall cardiovascular health and reduce the risk of cardiac events. Remember, individualized recommendations may vary based on your client's specific condition, overall health, and any other considerations. You always want to make sure that you consult with their healthcare professional or cardiac rehabilitation team for personalized guidance and recommendations tailored to their needs. Exercise helps improve cardiovascular fitness, strengthen the heart, and promote overall health. It's important to start with low-intensity activities and gradually progress. Common aerobic exercise for post-MI patients include walking, cycling, swimming, and using cardio machines such as treadmills or bikes. The intensity and duration will be gradually increased based on their tolerance and recommendations by their healthcare team. 3 to 5 days per week of 20 to 60 minutes sessions at an intensity of 40 to 80% of VO2 max or heart rate reserve, or if they are taking beta blockers or calcium channel blockers that may decrease their heart rate, you want an RPE of 12 to 16. Strength training exercises help improve muscle strength, stability, and overall physical function. The focus should be on the major muscle groups and exercises that are appropriate for their fitness level. Initially, light weights or resistance bands may be used, and the intensity can be increased gradually over time. It's important to use proper form and technique, and the guidance of a qualified person is recommended. You really want for them to do 2 to 3 days per week at 10 to 15 reps of 8 to 10 exercise overall, working all the major muscle groups. And intensity should be moderate, so 60 to 80% of an estimated 1 RM or an RPE of 11 to 13. And just make sure they're breathing properly. You want to make sure they're not holding their breath. That's going to increase their blood pressure and the strain on the heart. The exercise goals for someone post myocardial infarction are aimed at promoting recovery, improving their cardiovascular health, and reducing the risk of future cardiac events. Here's some common exercise goals for individuals in the post-MI phase. The primary goal after a heart attack is to safely reintroduce physical activity and gradually increase exercise tolerance. Start with low-intensity activities such as walking or stationary cycling and gradually have them progress on their individual capacity and with medical guidance. Regular exercise can improve cardiovascular fitness, which is essential for overall heart health. The goal is to gradually increase exercise intensity and duration and to improve endurance and aerobic capacity. This can be measured by improvements in functional capacity, such as the ability to perform daily activities without undue fatigue or shortness of breath. Strength training exercises can be incorporated into the exercise program to strengthen the muscles and including the heart. Focus on the major muscle groups and use appropriate resistance or weights under the guidance of your personal trainer. The goal is to improve muscle strength, and endurance over time. Exercise plays a crucial role in maintaining a healthy weight, managing blood pressure, and controlling other risk factors for cardiovascular disease. Setting goals related to weight management, blood pressure control, cholesterol levels, and blood sugar control, if applicable, can be important for long-term health. Exercise is often combined with other lifestyle modifications, such as adopting a heart-healthy diet, quitting smoking, managing stress, and improving overall lifestyle habits. The goal is to improve these modifications into daily life to support cardiovascular health and reduce the risk of future cardiac events. Adherence to medications and medical recommendations, consistency with medication regimens, and following medical recommendations are crucial for managing cardiovascular health. The exercise program should support adherence to medications and integrate with the overall medical management plan. The ultimate goal is to establish a long-term exercise routine and maintain a physical activity lifestyle. The exercise program should focus on providing guidance and strategies to help individuals continue exercising independently and incorporate physical activity into their daily lives. It's important to note that exercise goals should be personalized based on your client's individual capabilities, their medical history, and any recommendations from their healthcare professionals. Regular communication with their healthcare team is essential to monitoring progress, making adjustments, and ensuring that exercise goals align with their overall health condition and needs. A cerebrovascular event, commonly known as a stroke, refers to a disruption of blood supply to the brain. It can occur when a blood vessel supplying the brain is blocked, or an ischemic stroke, or ruptures and causes bleeding in the brain, a hemorrhagic stroke. Strokes are serious medical emergencies that require immediate medical attention. Here's some information about cerebrovascular events. An ischemic stroke is the most common type of stroke, accounting for about 80% of all cases. It occurs when a blood clot or plaque builds up in a blood vessel, reducing or completely cutting off blood flow to a specific part of the brain. The lack of oxygen and nutrients can damage brain cells, leading to various neurological deficits. A hemorrhagic stroke, on the other hand, occurs when a blood vessel ruptures, causing bleeding in or around the brain. This can be due to a weakened blood vessel wall or an aneurysm, or high blood pressure causing vessel rupture. The bleeding puts pressure on the brain, leading to damage and potentially life-threatening complications. Common signs and symptoms of a stroke can include sudden weakness or numbness, especially on one side of the body, including the face, arm, or leg. Sudden confusion or trouble speaking and difficulty understanding others. Sudden vision problems such as blurred or double vision. Sudden severe headache with no known cause. Sudden dizziness or loss of balance, coordination, or difficulty walking. It's important to note these symptoms can vary depending on the area of the brain affected and the severity of the stroke. If you suspect that someone is experiencing a stroke, it's crucial to act fast. FAST is an acronym for face, arms, speech, and time. Face, you want to ask the person to smile and check if one side of their face droops. Their arms, ask the person to raise both arms and see if one arm drifts downward. Speech, ask the person to repeat a simple phrase and listen for slurred or garbled speech. Time is crucial in stroke treatment. If you observe any of these signs, call emergency services immediately. Prompt medical attention is essential for a stroke because of early intervention can minimize brain damage and improve outcomes. Treatment options for strokes include clot-busting medications for ischemic strokes, surgical interventions for hemorrhagic strokes, and rehabilitation to regain lost functions and prevent future strokes. Preventing strokes involves managing risk factors such as high blood pressure, diabetes, high cholesterol, smoking, obesity, and leading a healthy lifestyle. Regular exercise, a balanced diet, maintaining a healthy weight, managing chronic conditions, and following medical advice can help reduce the risk of cerebral vascular events. If your client is experiencing symptoms suggestive of a stroke, it's crucial to seek immediate medical condition attention to minimize potential damage and improve their chances of recovery. For individuals who have experienced a cerebral vascular event or a CVA or stroke, exercise plays a crucial role in their rehabilitation process and promoting overall recovery. Exercise can help improve physical function, mobility, and quality of life. However, it's again important to work with their healthcare professionals, such as physical therapists or rehabilitation specialists who can provide specialized exercise guidelines based on the individual's specific condition and needs. Here's some general guidelines for those who are post-CVA clients. Medical clearance and assessment. Again, before starting an exercise program, it's crucial to undergo a comprehensive assessment by a healthcare professional. They will evaluate the individual's physical abilities, balance, coordination, and any specific considerations related to the CVA. Medical clearance will help determine the appropriate exercise intensity, type, and duration. Individual exercise program. An exercise program should be tailored to the individual's specific needs and abilities. They may include a combination of cardiovascular exercises, strength training, balance, and coordination exercises, and flexibility. The program should be gradually progressed based on their individual tolerance and response to exercise. Aerobic exercise is going to help them improve their cardiovascular fitness, their endurance, and health. So examples of walking, stationary cycling, swimming, or using cardio machines. Always start with low intensity activities and gradually increase the duration and intensity over time based on their abilities. 3 to 5 days per week of 20 to 60 minutes, or put it into multiple 10-minute sessions throughout the day, depending upon how they tolerate it. And their intensity of about 40 to 70% of their VO2 max or heart rate reserve, or their RPE of 11 to 14. And strength training exercises, they help to improve their muscle strength, functional ability, and their overall physical function. Focus on exercises targeting the major muscle groups such as the legs, arms, and core, and use resistance bands, light weights, or body weight exercises initially. And progress gradually with proper form and technique, and make sure again that they are not holding tightly to the equipment and increasing their blood pressure and increasing the possibility for another stroke. Post-CVA individuals often experience balance coordination impairments, so including exercises that challenge their balance and improve their coordination can help regain stability and enhance mobility. These may involve specific balance exercises like walking drills or activities that require coordination and proprioception. Stretching exercises can help improve flexibility, range of motion, and prevent muscle tightness. You want to incorporate gentle stretching exercises for major muscle groups, paying attention to any areas of tightness or limited range of motion. As far as their strengthening, they should be doing 2 days per week on a non-consecutive days for 1 to 3 sets of 8 to 15 reps at 50 to 70% of the 1RM for a total of 8 to 10 exercises. And their intensity should be an RPE of 11 to 14 on a scale of 6 to 20. And again, make sure they're avoiding excessive blood pressure increases by holding on to things too tightly or using the Valsalva maneuver. So again, just make sure they're breathing properly and not holding their breath. Range of motion exercises performed before and after your training sessions, as well as on non-training days, is important as well. Peripheral artery disease is a condition characterized by the narrowing or blockage of arteries that supply blood to the limbs, most commonly the legs. It is usually caused by atherosclerosis, which is a buildup of plaque in the artery walls. PAD can result in reduced blood flow to the affected areas, leading to symptoms and complication. Here's some more information about PAD. The most common symptom of PAD is intermittent claudication, which is leg pain or discomfort that occurs during physical activity and improves with rest. Other symptoms may include leg numbness or weakness, coldness or coolness in the lower leg or foot, sores or wounds on the foot or leg that heal slowly or not at all, decreased hair growth or hair loss on the legs, changing in skin colors such as paleness or blueness, weak or absent pulses in the legs or feet. PAD or peripheral artery disease can be classified based on the severity and location of arterial blockages. Most commonly used classification systems are the Fontaine classification and the Rutherford classification. The Fontaine classification system categorizes PAD into 4 stages. Stage 1 is asymptomatic. There are no symptoms that are present in this stage. However, there may be evidence of arterial disease upon diagnostic testing, such as abnormal ankle brachial index or imaging findings. Stage 2 claudication is characterized by intermittent claudication, which is pain, cramping, or fatigue in the muscles of the lower extremities during physical activity. The symptoms typically subside with rest. Stage 3 is rest pain. So in this stage, individuals experience pain in the legs even at rest. The pain is often worse at night and may be relieved by hanging the legs down from the bed. Stage 4, you start to see ulcers and gangrene. This is the most severe stage where individuals may develop non-healing ulcers, open sores, or tissue damage causing gangrene in the affected limb. The ulcers and gangrene may lead to infection and require more aggressive interventions such as revascularization or amputation. The Rutherford classification system also categorizes PAD into different stages based on clinical manifestations. In category 0, they're asymptomatic, there aren't any symptoms present. Category 1 is mild claudication. So mild symptoms of intermittent claudication are experienced with limited walking distance. Category 2, there's moderate claudication. So moderate symptoms of intermittent claudication are experienced with further limitations in walking distance. And category 3, where it's severe claudication and they're unable to walk more than a short distance. Category 4 is ischemic rest pain. So this is pain in the foot or toes experienced even at rest. Category 5, there's some minor tissue loss. So non-healing ulcers or superficial tissue loss or partial thickness skin loss that occurs. In category 6, there's major tissue loss. So extensive tissue loss, full skin thickness, or gangrene is present. Both classification systems provide a framework for categorizing the severity of peripheral artery disease based on clinical manifestations and can guide treatment decisions. The classification helps healthcare professionals determine appropriate management strategies and interventions for individuals with PAD. It's important to note that these classifications are general guidelines and the specific presentation and severity of PAD can vary among individuals. A healthcare professional specializing in vascular diseases can provide a more detailed evaluation and classification based on individual circumstances. The claudication pain scale is a subjective rating system used to assess the severity of claudication pain experienced by individuals with PAD during exercise. It helps healthcare professionals and individuals track changes and pain levels over time and evaluate the effectiveness of interventions. The scale typically ranges from 0 to 4, with each number representing a different level of pain intensity. Here's an overview of the claudication pain scale. So 0 is no pain or discomfort experienced during exercise or physical activity. 1 would be mild pain or discomfort that's felt in the affected muscles during exercise, but that it doesn't necessarily limit activity significantly. The pain is tolerable and does not require stopping or resting. 2 is a moderate pain that is experienced or discomfort during exercise, causing some limitations in activity. The pain may require slowing down, reducing intensity, or taking intermittent breaks to alleviate symptoms. And 3 is severe pain or discomfort is felt during exercise, significantly limiting activity. The pain is intense and may require frequent stops or rests to relieve symptoms. Individuals may be unable to continue exercise for an extended period without experiencing substantial pain. And 4 is very severe pain or discomfort is experienced during exercise, causing marked limitations in activity. The pain is intense and may be unbearable, requiring immediate cessation of exercise. During exercise, individuals with claudication are typically asked to rate their pain level using this scale to provide a subjective assessment. It's important to note that pain tolerance and perception can vary among individuals, so the scale serves as a general guide to help communicate the severity of claudication pain. The claudication pain scale is just one component of elevating claudication symptoms. Other factors, such as walking distance, time to onset of pain, and recovery time, are also considered when assessing the impact of claudication on an individual's daily activities and exercise tolerance. Healthcare professionals may use additional assessment tools and objective measures, such as the measurement of the ankle brachial index, or ABI, to provide a comprehensive evaluation of claudication symptoms and guide treatment decisions. Since PAD is a systemic cardiovascular disease, the personal trainer must be aware that clients with PAD require the same exercise programming and monitoring considerations as those with cardiovascular disease and hypertension. Depending on the severity of their leg symptoms, individuals may be able to walk continuously for only a limited period of time, such as 1 to 5 minutes. The client will not say it hurts or aches a lot. It will hurt or ache a lot. Clients will not be able to walk through the pain, rather than they will need to stop, sit down, and rest. When working with those with PAD, you can incorporate strength training exercises to help improve muscle strength and endurance. Focus on the major muscle groups such as the legs, arms, and core, and use resistance bands, light weights, or body weight exercises. Start with lower resistance and gradually increase as they tolerate it. 6 to 8 resistance exercises targeting all major muscle groups, but focus more on large lower limb musculature if time is permitted. Performed twice a week on non-consecutive days. Their intensity should be of 60 to 80% of the 1RM as recommended. A reasonable goal is to have the client perform 3 resistance exercises and 2 or 3 sets of 8 to 12 repetitions. And that is all that I have for you today. I look forward to talking with you again soon. We'll be going into part 3, and that is more of the respiratory conditions. I'll talk with you soon. Have a great day.